Hello, my name is Jan Klusacek, and this is a new episode of our EuroHealth podcast. Our guest today is Professor Aileen O'Gorman. She's, I'm sorry, it's so long, really need to read that. She's a professor of substance use and social policy and program leader of the MSc in Contemporary Drug and Alcohol Studies at the University of the West of Scotland. Welcome, Professor.
Thank you. Good morning.
So maybe we could start with a personal question. What actually brought you to this area of studies?
I suppose I'm interested in, so my title is Professor of Substance Use and Social Policy, and for me that's really important that we make the link between two. So I'm interested in the phenomenon of why people use substances, be they legal or like alcohol is in most countries, or illegal, but also why people develop harms from their substance use. And that to me and the work I do is very much related to social policy issues. So it's about poverty, it's about education, it's about housing, it's about the kind of life experience that people have. So I'm really interested in the two of those. But I guess I'm Irish, so growing up in Ireland, you have, I think, a strong sense of social justice. When a country that was formerly colonized, your history is very much about social justice. So I think that a lot of Irish people work, in human rights in those kind of areas. So I was always interested, even when I began my studies in politics and sociology, in European studies at the time. And then I went on to study in London, in the University of London in Birkbeck College. And one of my professors there was Suzanne McGregor, who became my PhD supervisor. And she taught us political sociology and kind of blew my mind about social policy issues. She'd just written a book about drugs in British society, so documenting the big changes that had happened around drug use in the 80s in London and in many European countries. So I was really interested in that as a social phenomenon and, as I say, that link with inequality. So for me, that's the real interest, is in the link between substance use harms and inequality.
Well, I think it's a bit newish area of scientific studies. It's because, for many years, substance abuse was considered mainly a medical issue, so within the psychiatry, addictology. But this is much wider approach and much more complex, I guess, and not definitely based on individual needs of the person who is abusing. So, do you think that young people these days are more interested in this wider and more complex approach?
I think the young people are interested in taking drugs. So I'm not too sure, like I did when I was young, how much I thought about that. But I suppose for me, being a social scientist, there is a difference in our approach, in our thinking, in our analysis, compared to, we'll say, a psychiatrist who deals with substance use as a medical problem. And you use the term abuse. So as a social scientist, I suppose part of our role, if you like, in this study is about, I would use the word use, because we try and avoid, maybe stigmatizing people, but people who use drugs, particularly the more what are called high-risk drugs, are a very stigmatized, marginalized group of people. So I think the role of the social scientist is to, stand back and take an objective, sort of value-free, judgment-free analysis of the situation. With something like drugs, it's, part of my interest in the subject is how the use of drugs has become framed in different societies, in different places, different cultures, as a good thing or a bad thing. And as I say, how that relates to stigma and marginalization of people. I think young people, I suppose this goes back to my idea about lots of people use substances, and particularly young people. That is, the time in your life when you will experiment with different substances. Whether you continue on as mature and grow older, it varies for different people. But the real interest is when that use becomes a harm. And for me, going as I said, being the social policy analysis. I'm really interested in how those harms are affected by your position in society, your socioeconomic status, your class, your gender, your race. So lots of people use substances, and particularly younger people. But the interest then is in who develops harms around their substance use. So I suppose the psychiatrist will come at it from that kind of medical, and again, it's a framing. So I would argue with the psychiatrist about that this sort of medical approach and the medicalization of what essentially is a social issue is not the way forward. And I think, we see that now because a lot of, I suppose, treatment that started coming in the 90s and the early 2000s hasn't really resolved the situation. Because when you look at the data, it is a social issue, not just a medical one. If that answers your question.
Well, definitely. There was even, I would say, wider answer than I was hoping for, but that's really interesting. And, my next question might be whether, what you are talking about, what you are presenting, what you are writing about is about policies, that might actually border the politics. So don't you think, or aren't you afraid that it might, that your area of studies might actually become a victim of the culture wars, just like other areas like sexual health, etc., sexual education? We see that in the United States. We see that in many other countries. Maybe not so much in Scotland or Ireland, but we see that scientific research is getting a victim or at least a hostage of culture wars sometimes.
Yes, but I think in the drugs field that has been happening for a long time because, as I said, it is an issue that is framed, as something that's a very deviant, bad behavior. When you compare it to alcohol use, which is legal in most countries, that's a very different framing. They're both psychoactive substances, which change mood, which change consciousness. But the use of those substances isn't a direct. So depending on the drug you've taken, there's a famous Norman Zinberg concept about drug set and setting. So the outcome of any substance use depends on the drug you've taken, how much, etc., your mindset at the time, and also the environment in which you take it. So it's not just a direct outcome from taking a substance. So to go back to your question, which I've now forgotten, but what was your... the culture wars, sorry, yes. So I think drugs as an issue has always been framed in this very judgmental way, and that hasn't changed. So I think the culture wars, if you like, haven't affected that so much. But you do see an increasing lack of tolerance particularly, so I work in the UK, I've worked in London for many years, worked in Ireland and Dublin for many years, and now in Scotland. You do see a growing intolerance, particularly in England, I think, of difference, of people who are marginalised, of people who haven't succeeded, as would be put, in their life. And it's become, their life experience has become depoliticised. So part, you might argue, of the neoliberal project is that you individualise social problems. You make it down to you as an individual. This is your fault, if you like, for being in your circumstances, and you're responsible for addressing it. So in that sense, it becomes depoliticized, that the role of the state and the society we live in and the decisions we make about how resources are shared becomes less and less an area of discussion. So you have a lot of fake news, and I suppose as a researcher and as a teacher, one of the things we now have to focus on much more with our students is, what is evidence? When they're writing their essays and doing research, how is this evidence produced? What's the source? And being really accurate, I think. And the role of the social scientist, I think, now is to really be conscious of trying to find, in some sense, a true reality, and proper evidence, proper researched evidence. Now, the other part of me as a social scientist would say all knowledge is constructed anyhow. So you're kind of torn, you have this tension between that. But I do think we have to be careful about, the information we receive, about really being critical thinkers. So now as a teacher, I think my main role is to educate students to be critical thinkers and to really assess the information they get. So, yes, so to answer your question, I think because drugs has been such a sort of demonized issue throughout history for a lot of political reasons, it's probably more of the same, really. Currently.
Well, do you think that your area of research was somehow influenced by the Brexit? You have direct comparison from UK with Ireland. Do you think that the general political and public atmosphere towards drug use, I'd say, or substance use, has somehow shifted since the Brexit?
I'm not sure if Brexit has had, or it's probably quite early yet. I mean, it's had so many effects on people anyhow, particularly living in the UK. And I suppose I'm lucky in one sense. So I'm Irish, I live in the UK, and because of the old sort of imperial relations, we have a special status to stay and work there. But I know many European colleagues in Scotland and in England who have difficult, non-European or other Europeans other than Irish, have had real difficulty in staying to work. And I suppose academics, I've been involved in a lot of European countries looking at their drugs policy and drug issues there, and the freedom of movement around Europe, and the fact that Brexit now, as academics, affects us. I mean, it affects everybody else, but that is a real difficulty. But of one of the many difficulties, drug use as such, I'm not sure. I mean, two of the things that spring to mind. One is we have a European, it's called the EMCDDA. It's the European Monitoring Centre for Drugs Addiction, but it produces a lot of research from all the European countries. So for example, was able to go and look to see what the situation in the Czech Republic is and compare that to Ireland, but not to the UK, because the UK is no longer part of that. It's kind of like a stepsister. It's slightly outside. So less and less data has been shared so that we can compare issues around Europe. So that's a definite change. But the drugs market, which of course underpins all of what we're talking about, how much that will change over time, because as it becomes more difficult to move into the UK, then the importation of drugs becomes more difficult, and I think in terms of how the drugs economy might be affected, as more. It's only now really that a lot of the Brexit rules have come into play. There was initial 2 years, and then there was COVID, so it wasn't really clear what the outcome was going to be. I think now we're really beginning to see those changes. And I have to say that I don't think they're good. So I'm quite a European, as an Irish person. I think we see ourselves as European, which is probably quite different to a lot of UK people.
Well, I know from your presentation at last year's Lisbon conference that Scotland has the highest rate of drug-related death of all the European regions. So maybe you could explain a bit why is it so?
Yes, I mean, it's one of the great sadnesses, I suppose. As a social scientist, we try and not be emotional, but I think the level of drug deaths in a relatively small country, so, similar population size to the Czech Republic and to Ireland, and the comparison, for example, so in the EMCDDA data, I noticed that Czech Republic has really low drug-related deaths. So it's quite, the difference is quite phenomenal. So in Scotland, they're very much at a very high level of health inequalities in Scotland. So the drug-related deaths, again, as a social scientist and interested in substance use and social policy, those drug deaths aren't just drug-related, they are also socially related. They're very much embedded within the inequalities within society. So, Scotland is an outlier in terms of the level as I said, of health inequalities. So life expectancy can change, between, you mentioned Glasgow earlier, the more wealthy parts of Glasgow to the less wealthy parts. There can be a 10-year life expectancy difference, which is quite phenomenal in the 21st century that happens. So, for me, the drug-related deaths is very much embedded within that. At the talk we gave in the Lisbon Addictions Conference, so there was a group of us who worked together, and we're all interested in this similar issue about how drug use is framed, about how it's more of a social issue than just a medical or even health issue. So my study was looking at deaths among young people in Scotland. And in particular, the title, if I remember, was about the social, structural and systemic factors influencing that. And I had been developing this methodology called a social autopsy, because when people die of a drug-related death, there's usually a formal autopsy because it's sudden, unexpected death. But the autopsy focuses on the health condition of the person and the drugs they've taken. And the death becomes framed as a result of taking that drug. So returning to that Zinberg concept of the drug set and setting. So I was really interested in trying to understand what the set and setting part of those deaths were. So trying to understand the social, the environmental risks that people may have experienced in their lives. So for the young people who had died, we were able to access records of their health, of their kind of journey through the addiction system, their journey through a psychiatric system. And you could see when you began to read those reports and knowing that it had ended in their death, you began to see very clearly a kind of trajectory of just really difficult circumstances that people lived in. But that the state really had failed to support people who were very vulnerable. Often there was maybe family poverty, a breakup of a family, which is not uncommon in modern society, but because of the situation, the family and the poverty and the lack of power and resources they had, children ended up in care, either in care with other family members, sort of informal care, or in the care of the state. And the outcomes from that really are bad for everybody. They're bad for the parents, they're bad for the kids. There's no really positive outcome from that. So there was, we were able to piece together a sense of their lives and the difficulties they had experienced, and just the failure of the systems and the state to support people who had, really challenging life circumstances to deal with.
Could this be considered a global rule, that there is a direct link between the socioeconomic status and the risk of drug-related death,
Yes.
and maybe drug use in general?
Yeah, I mean, yes and no.
Okay.
So I think yes. So again, as social scientists, we look for patterns. We look to see. So in Scotland, it's very clear that we have areas of deprivation. Yep. And the risk of dying from a drug-related death, I think it's 15 times higher in the more deprived areas. And that is true of a lot of the northwest of Europe, let's say. So in Ireland, in the UK, and in a lot of European countries. So Scotland's rate is on par with the United States and with Canada, who also have really high levels of drug-related deaths. The situation in Canada is quite similar. In the United States, there's a slightly different dynamic happening because a lot of the drug-related deaths are related to what we call synthetic fentanyl, opioids, that in the United States, because of their peculiar health insurance system and private health insurance, a lot of people were prescribed opiates who had health insurance, i.e. were quite well off, because to have health insurance in the United States is a very costly thing. So there you see a slightly different trend. So it's not just people from the poorer areas or people from the black communities, where normally have more challenging life situations, particularly in the United States. But often a lot of middle class professional people were affected as well. So there was a slight difference. But then again, so the two economists, Case and Deaton, I don't know if you've heard, they use the term debts of despair. So they wrote quite an influential book in the United States documenting where most of the deaths had happened in the United States. And it tended to be in sort of more rural, deindustrialized towns, which were really poverty-ridden, mostly white communities, who just were living lives of, with very little hope. So hence the title being Debts of Despair. So yes, in some countries it can, another example is Switzerland, I think back in the 80s. So their original heroin epidemic was very much a middle class issue. And Switzerland were, and interestingly then, because how policy evolves very differently when it's a middle class issue. So Switzerland were very early on in terms of being harm reduction, in providing needle exchange services, in providing heroin assisted treatment. Because it was the middle class that were most affected. Anyway, back to today. So it's, so there are differences in different countries, but by and large, the pattern is very much about drug-related harms are very much linked to your power in society, your income, and this, the insecurity. So we talk a lot nowadays about insecurity and precarity, about the lives that people live, and the lack of power people have. And under those conditions, substance use can become quite harmful, because if you have very little else going on in your life, substance use can become the main focus, and for many people a pleasure. We must not forget that people take them for particular reasons.
Well, it's a good point, because I wanted to ask about what we've been talking about so far is mostly illegal drugs.
Yes,
if we use the illegal in a general term. But what about alcohol and tobacco that are legal in most countries, as you mentioned? So on, I would say, anecdotal level, it's also could be seen that the level of alcohol and especially tobacco use is much higher in lower income groups, even in Czech Republic. But Czech Republic is fighting for every year for number one in alcohol use in the whole EU, which is a terrible trend, and it's a trend that is completely socially acceptable. It's I think it may be compared a bit with Scotland, because when I flew last time from Glasgow, there was this nice middle-aged couple just on the seats next to me, who considered it completely normal, and of the steward as well, to order vodka for their breakfast at 8 a.m. So, that I don't think that's something that would be considered completely normal in France, or maybe in other countries. So is there this link of higher risks in relation to socioeconomic status in those drugs as well?
I will say, though, in defence of my Scottish colleagues, that having vodka at 8 o'clock in the morning is, would not be a usual occurrence.
Wanted to lighten up the mood.
But yes, but I take your point. And, and Ireland, Scotland, Czech Republic, are up there always in terms of alcohol. But what's really interesting is the three countries, also in terms of the political economy, the alcohol industry is hugely important, and there is no coincidence between the levels of use, but also how normalized it is within our societies, because the alcohol industry is very powerful, a very strong lobbyist. And I always think, I would say to our students to compare how alcohol is regulated with drugs which are illegal. And I think it's interesting. I know in the Czech Republic, I know you have decriminalized possession for quite 10 or more years. So you were one of the early countries to do that. In the UK and in Ireland, we're really still fighting that challenge. So, certain
And
European countries
we are
have...
hoping moving towards at least some level of legalization of even business approach to marijuana. We managed to implement medical marijuana in the system, which is not optimal in the way of but at least we have it. So I think in that Czech Republic is pretty advanced. But it's always two steps forward and one step back. But
no, but I know in my work at European level, I would have worked with Tomasz Zabrański, who is a wonderful advocate of harm reduction. And I remember when I first met him as a young researcher, and he was talking about heroin-assisted treatment, and I had never heard of this. I thought, wow, this, So I think his influence, and very sadly died during COVID. I think has been great, not just in the Czech Republic, but in the European Union as well. Having those, I think, voices that make sense to people, but are calling for something different, I think is really important. So yes, to go back to alcohol, I think that's so interesting how we normalize alcohol use so much within our society. And we don't do the same for drugs that are illegal at the given time. So how political economy, I think, works with that is really interesting. So I guess one of the concerns, and probably the only one I have, if we regulate the illegal drugs industry in the same way that we regulate alcohol, will we create a new drugs economy? And we've seen this in the United States, where the growth and the power of the industry that is now producing particularly cannabis and all the different types of cannabis you can now buy in a lot of the United States. And I suppose within the group of researchers I work with, they're looking for some kind of alternative model, that it doesn't have to be the kind of the super corporative model. So, for example, in a lot of European countries, there are what they call cannabis social clubs, which I think was a Spanish idea initially. And the idea that they could be small sort of cooperatives growing cannabis for use within the members of the cooperative. And therefore, you're not bringing in the big multinationals. And I think that appeals to a lot of people who smoke cannabis, who probably tend to be more, less in favor of extreme forms of capitalism. But... So, it would be good to try and see how we can do it differently maybe than the alcohol, because the alcohol industry issue has been really difficult. And, in Scotland, there's a very clear example. They wanted for many years to introduce a policy called minimum unit pricing, which meant that the kind of very strong... we kind of call it white cider, so it was very cheap that people were buying litres, and if it was really at that level of kind of the harmful alcohol use. If you couldn't afford spirits, you drank this. So they introduced the minimum unit pricing to try and discourage the use of those types of alcohol. And the alcohol industry lobbied for years and years quite successfully through the courts with a lot of money behind it to stop it. Eventually, it was introduced, but I think it took about 5 years. So to go back to your question about, why Ireland, Scotland, Czech Republic, Denmark have high levels of alcohol use, there is a huge alcohol industry behind that, which, as I say, normalizes alcohol use in a way that I think doesn't happen so much in other countries.
But why is it that the approach towards alcohol on one, and then towards tobacco is very much different, and even the social acceptance of alcohol abuse, I would say, is much higher than social acceptance of smoking. If you see someone smoking on the street, normal cigarette, then it's like I think it's 90% probability that it's someone working manually, someone unemployed, someone at a lower economical status. So how is it that smoking has become not so much acceptable for middle class people, yet drinking or binge drinking is perfectly okay?
Well, I think binge drinking happens across class. So I think I'm not quite too sure if the data would support that. But yes, to go back, I suppose, to the tobacco issue. But there has been a long history, of tobacco. If you look back at the early films and everybody's smoking and how tobacco use was normalized over a long time, gradually. And maybe it was because the corporations were super national, if you like, whereas alcohol industries tend to be more local, nationally based. So maybe their influence waned. I guess also there was a very clear, direct link in early research evidence about the link between tobacco use and health, and cancers in particular. And then the medical profession, came very strongly in support of. But it took a long time for that to happen. And yes,
and a lot of research, because I know that even in the 60s there were special cigarettes marketed in Czechoslovakia back then for asthma patients, because that was supposed to be helping with asthma.
Yes. And you sort of see a similar with alcohol and the research that's been conducted, because even I, as a so-called expert, although less maybe on alcohol than the illegal drugs, but get confused about, well, what is the current state of the research evidence? Is it, for a long time it was a very small amount of alcohol was perfectly okay. Now they're saying absolutely no alcohol anytime. So that that is difficult. Then what message do you give? Even taking out the politics and the economics of it as a health professional, what message do you give when the evidence isn't really clear? But I think the evidence in tobacco just became a lot clearer, a lot earlier than alcohol. But it is an ongoing, interest about why alcohol is so. And even, I say to the students to look at TV programs in the UK, and there's a lot of programs around, where you live, buying a house, and they're really popular. And in all of the programs, they talk. When they're showing people around what could potentially be their new home, they say, imagine yourself having a gin and tonic sitting here or a glass of wine in the evening. So alcohol becomes really framed as this very normal part of our well-being, and it's a drug we can admit to taking because it's and we can even say we enjoy taking it because it's legal. We can't say the same about illegal drug use, because people think, there's a different framing of that issue and a different sort of value judgments attached to it.
I know you are not a politician, but maybe you have some recommendations towards politicians. So what do you think that well-meaning politician should try to push through in the area of your research? Do you think that it's about, on the first level, it's about improving the access to quality healthcare, or it's about general improving of the quality of life, and then the decrease of drug abuse should come with that, I would say, automatically?
Yes, and there's been some interesting research done. The name of the author escapes me, but in terms of reducing drug deaths, that so they've done some economic modelling to show that if you increased the income of people in a country, then the drug death rate would fall. Now, we'd have to test that hypothesis, put it into action, but it would be certainly interesting to see that. And even though you say I'm not involved in politics, but in the UK in particular, academics are more and more encouraged to become involved in talking to politicians and policymakers and trying to make sure our research has impact on the work they do. So I am sort of involved in that scene. I would very much be advocating for harm reduction. I think part of the Scottish story in terms of the growth of drug-related deaths has been a move away from harm reduction. I would argue that very strongly, and not many people like to hear that argument. But Scotland was very much a leader in terms of harm reduction in the early days of HIV, introducing needle exchanges and introducing medication-assisted treatment. But that, as a policy decision, sort of went backwards. So you said in Czech Republic there was often step forward and back. So that was very definitely a step back towards what's called recovery. So this word is used a lot in the UK to talk about people with substance use problems and the idea that they're on the road to recovery. But the recovery is usually framed as something that's quite individualistic, about individual people taking responsible for their recovery. And the role of the state and the role of policies which create the conditions in which drug-related harms happen is often ignored. So I would say to politicians, of course they don't like this because they want an easy solution and they want a solution that can be measured and you have targets that you achieve and outcomes. And that probably won't happen with the suggestions I make. But I think we do have to look at the social issues that underpin the drug deaths if we are to take it serious. We do have to look at harm reduction in all its forms. So in Scotland, there's been a long call for drug consumption rooms. So a lot of the deaths in Scotland in terms of the drug are heroin related, injecting heroin use. So if you provide a drug consumption room where people can inject safely, there's a very high level of homeless people who are injecting drug users. So if you can provide people with a safe place to use, then the deaths would decrease.
Yes.
My beg your pardon.
It's actually funny
yes.
and sad at the same time to hear about that discussion, because that discussion is held in Czech Republic as well with the safe application rooms, and I think that it's for many voters it's just more acceptable to hear about this hard approach and about criminalization and about more cops than to hear about harm reduction and spending money on needle exchange or safe rooms, even if there is hard data showing that actually it's cheaper and it's more effective to invest in harm reduction. But for many people who are just voting, etc., they don't want to hear that.
And you could see that when the idea was introduced in Scotland, I think 4 or 5 years ago now. And at the time, I asked the students to, monitor the social media, see what the discourse, the discussions are about this. And of course, a lot of the newspapers, had really quite challenging headlines about, basically you were giving people free heroin, of course, fake news and all of that. So I think
I think that British newspapers are special with their headlines.
Yes, and some dreadful headlines. Yeah. And I think that's begun to improve. That now, there's been a lot of work, advocacy work done with journalists to try and have a more kind of neutral language used about the use of substances. But it goes back to return to what I said earlier about the framing of this issue. And one of my interests in it was, why substance use is framed in a particular way. So partly it's the role of the media in terms of the information people receive and what they observe on their streets, I suppose. But it's also how that issue is framed. So again, if you demonize a population, it's very hard then for policymakers to come up with suggestions that are enabling people or seen to enable people in their drug use, because people, why would you do that? And this is why, evidence is so important, and the evidence around harm reduction is really clear, that, medication-assisted treatment is really useful, needle exchanges to prevent HIV and hepatitis C, drug consumption rooms where, particularly if you have homeless injecting drug users, that providing people with a safe place to use works. So it is that battle, isn't it? That contemporary battle of ideas about, what the evidence is, what can improve it. But politicians, I suppose, they feel they have to respond to what the people who elect them think. So, it is, I suppose, a game in some ways about that. And if their constituents, if they're the people who elect them, want something more hardline because that's what they hear in their news and the social media, it's hard for a politician to say, no, we need to try something different. And the solutions will probably not be instantaneous. It will be a few years forward when you begin to see the results. And if your election is next year, then it's very difficult as a politician to advocate for that. So it's a very complicated issue and a difficult policy issue, I think. But for me, I suppose that if we see drug use as a social policy issue, if we can get that debate and discussion going, I think we might begin to change minds about what needs to happen.
I think there's a strong link with the accessibility of mental health care, and I see that it's the very same case. If a politician says that he will create more accessible, cardiology care, that if you get a heart attack, you will be treated in 30 minutes, and it will be very fast, and the ambulance is coming for you. Well, it's a popular project, but if he says, we'll make mental health care or addictology care more accessible, well, then a lot of voters say, well, that cannot happen to me. That doesn't interest me. That's just wasting money on some drug heads, and I don't care about them. Yeah. Yet it happens until that happens to him or his family or his friends, because that can happen to anybody.
And I mean, the mental health issue, I don't think I covered. It's such a key social issue of our time, a key social challenge of our time, and I think particularly since COVID, and then now so many wars around the world, so close in Ukraine, people, and particularly young people, it's a very difficult world to live in and to keep your mental health. But I think, it's hopeful in some sense that there's a lot more discussion about this. 20 years ago, 30, nobody mentioned it. It was something that was quite hidden. I think the more it's spoken about, I think that may change things. And because it's quite a universal issue, that may change, because policy will respond to something that's more universal. Even though, again, mental health is very much embedded within those social policy issues. So if you've insecure income, insecure housing, insecure work, your stress, your anxiety, your depression levels will be much higher than if you have, you're going to be paid next month and you have a home and it's secure, and that your mental health is probably, you've better opportunities to have good mental health in that area. But I think, the Commission now is starting to look at mental health and substance use. Well, there's a kind of move that their mental health strategy would also include substance use. And the two, I suppose, again, there's a lot of mixed evidence about the two. It's a kind of chicken-egg situation sometimes. But I would argue, that the same contributory factors to drug harms are the same to mental health harms. So, as I mentioned, the insecurity, the precarity, that they really influence your mental health and your substance use. So in that way, I see a lot of similarity between them. In that research that I spoke about in Scotland, the young people, all of them had 87%, I think, had a mental health issue, that they had said they were depressed, they were anxious, they were stressed. There's a kind of professional role, which I suppose happens also with the drug issue, going back to that psychiatrist, the psychiatric profession, sort of ownership of mental health and addiction, that unless you have a diagnosis, sort of clinical diagnosis of either a substance use disorder or a mental health disorder, there's very little support for you. Well, even when you get the diagnosis, arguably, particularly in the UK, where the health service has really just collapsed without investment, without resources. So it's really difficult to get support if you have a diagnosis. If you don't have a diagnosis, but still are anxious, stressed, depressed, it's almost impossible, and particularly for young people. And I think, information from one of the European surveys, 1 out of 2, half of young people say, they have a mental health issue and their needs are not being met. And of course, this is one of the great social challenges about the meeting of needs of people. universally. So going back to, the ideas of universal healthcare systems where everybody's needs were met, as much as could be, that has really changed. And so I think there's very little support for mental health. But they are, so the EU Commission taking a role in that, I think is really promising. The World Health Organization is also, which I think is really interesting, is about the impact of economics on health. And saying that we really have, countries really have to rethink things like a measure of GDP, of your gross domestic product, is a kind of indicator of a healthy economy, and saying, well, no, we have to look at the health and well-being of the people, not just the profits that are being made. So I think when you start seeing the big European and international institutions saying, hang on a moment, that we need to change. And of course, linked then with climate change and the environmental crisis, they are all interlinked, really. So how the change will happen, I don't know, but I think there are some promising things happening. Yeah.
Okay, I think a huge chunk of our discussion was a bit depressing, but this I hope is something that we can be a bit optimistic for the future.
Yes.
That there might be some progressive changes in this landscape.
Yeah.
So thank you so much for your time. Thank you for coming.
It's a very enjoyable discussion. Thank you.